Welcome everyone into the studios today. Melissa Brantley from South Central Health District. We have Melissa here today to give us an update on the fast changing situation of the COVID-19 virus and maybe talk about some numbers. Welcome, Melissa.
Thanks for having me, Ron.
Yeah, so here we are again, Melissa, and you know, things have really changed. It seems like it's been a couple of months, and it really hasn't. You know, from the first cases, your weeks just kind of, I don't know, it seems like time.
Start running together a little bit. Time starts to stand still, I think.
Yeah, it sure does. I know you guys are extremely busy, and I'm sure with the onset of the new information from the governor that he's going to reopen, he's going to start the first phase of reopening, you guys have had to set a precedence of where you stand on that. So share with us where you stand.
Well, we will continue to work alongside the governor and his office to help implement the guidelines that he has set. We still continue to urge people to proceed with caution, to stay home if you can. When you do go out, to continue to wear cloth face coverings of some sort. It could be something as simple as a bandana put around your face that protects you, but it also protects the people around you. To continue to practice hand washing and the use of hand sanitizers, and to keep 6 feet between you and other people when you're out in public. So we will continue with that messaging, even as things start to open up and people start to return to somewhat of a, we're using the phrase new normal because I think it's going to be that way for a while. But to proceed with caution and continue to follow those 4 steps that we've been talking about for 5 or 6 weeks now.
Yeah, and South Central Health over 10 counties. In looking at just Lawrence County alone, we're around 50 cases. We've had 1 death, tragedy. But in counties around us, we have what is it, Wilcox, with a nursing home that's inundated.
We have some counties that have been hit harder than others. We've had several people say, well, why is it that a few of your counties only have a couple of cases, and then you have some that have these huge number of cases? A lot of it has to do in where kind of hot spots are. We know that one reason that we push the 6-foot guideline is to keep people apart. But there are some places where people live that they cannot stay that far apart, or where they are in close quarters when they dine and things of that nature. So prisons have been hot spots not only in our district but also around the state, and so have long-term care settings. So and that has certainly hit us hard as well. And so that's kind of what has happened in Wilcox County. Wilcox County is our most southern, southwestern county that we have. And if you look at it on the map, it's also kind of runs into that Albany Health District area. Albany has been a hot spot in the whole state. And really, if you look at it per capita, the whole nation. And so a lot of that could be spillover from the Albany Health District or that area that's kind of feeding into Wilcox County as well. Who really knows? But we know that long-term care facilities have been hit hard in our district. Not everyone, but we've had a few. It's
been difficult, or it is difficult, to be able to track where it all started, who it started with. Could be an employee that came in, someone to visit early on, one of the people in the nursing home. How do you feel at this point, as far as our nursing homes are concerned, if they haven't had a case? Do you feel pretty safe about them, or how would you be about your own loved one, Melissa?
Well, I will say this, in talking to those who work in long-term care facilities, they've been vigilant with making sure that they were following guidelines that the governor set, and they have been extra cautious. They want to protect those that live there and that they take care of. And I would feel comfortable. I feel like there are extra measures that are being taken now that will help prevent the spread. And if you look at, one thing we had talked about earlier is if you look at the number of long-term care facilities that we have in our health district, there are only a few where we've had outbreaks. So it's not across the board. And I feel like they are doing a great job at taking care of those in their facilities and making sure that they're protected. And I know it's hard on families. My heart goes out to families who haven't been to visit their elderly family members in long-term care settings, and we're going on 2 months now.
Wow.
And that's heartbreaking. But know that the management in those facilities has your family members' best interest at heart when they set those guidelines.
Yeah, and the entire
They are
community
really the
there.
most vulnerable populations as far as COVID goes.
Yeah, knowing that and looking at that and the fact that some of them are even taking temperatures, not only just when an employee or someone comes in, but also some of them are doing it every couple of hours or midday and beyond, just to make sure, just to go one more step. So of course the temperature is a key point, but in looking at our senior adults, look at the amount of our population that's over 60 that will be affected by this if they just say, okay, it's open,
Right.
let's go get a haircut.
Right. And it's not just, it is the elderly that if you look at the deaths that happen that are COVID, what we label COVID-19 deaths, most of them are in those over the age of 60. But it also affects those with chronic health conditions and those who have immune systems that are compromised. So you have to go and look beyond those that are the elderly, but we also have to consider those who are diabetic, who are on dialysis, who have kidney disease, who are on medications that may compromise their immune system. Maybe it's someone with lupus and they're on immunocompromising medication. So you have to look at those as well. And if we continue to practice those 4 things that we talked about, we're protecting us, but we're also protecting those around us. And certainly now is the time when you want to look out for others around. It's not just about us, it's about protecting other populations as well.
Yeah, and you think about how all that happened in South Georgia and how it's happened in New York is because of that close proximity, and then you think about you're okay as a young person, and we like to reiterate that when you go around a more feeble crowd of people, when you go to senior adults or those who are diabetic, have pre-existing illnesses, you're going to expose them to it, and you'll never know that you've done that, and lo and behold, it'll happen. So we should not look at this opportunity to start the first phase of reopening as congregating. I know in a lot of barbershops, beauty shops, that type thing, people want to congregate in there, and I believe there are rules that have been set forth, right?
Right, there are, and if you look at, and I urge people who are reopening to go to the governor's website, and it's gov.georgia.gov. So if you will go there are very strict guidelines before you can reopen, guidelines that you have to follow. And one is that you limit the number of people who are in your facility. I've even talked to people who are asking people to wait in their cars until they're called in. That's a recommendation.
Yeah.
And they've taken the seating out of the waiting areas of the barbershops or the beauty shops so that people aren't waiting inside. And that's so important because like you were saying, places that are hot spots, we can look back and see that there were places where people were congregating for an extended period of time, longer than 10 minutes, which can happen in any setting where you're in a waiting area.
Yeah, we're looking at, I believe it's for restaurants reopening, like 10 patrons within 500 square feet, I believe it is, something
Right.
like that. It's a real limited number on how many people can actually be in their seating. And I know we all want to go out and have a nice dinner if possible. I know we want to be able to go in and relax. But the restaurants are going to have to follow certain guidelines, just like the
They are.
barber shops, just like if it's a tattoo parlor or whomever.
Right. So with restaurants, and like I said, some of the guidance just came out last night, and so it's actually fairly new to us as well. But 6 people would be a limit in a family-style dining experience. So, you couldn't have more than 6 people at a table. That's
Yeah.
one thing.
Okay.
And that there's 6 feet between a table, a family gathering where they're eating, and between another table. So that 6-foot rule is still going to extend even to restaurants when they open. And then you were saying you have to look at the facility size too, the square footage. There are guidelines for that, and those are set on the governor's website as well. So restaurants and other places that are starting to open have to look at that and see how many people can you actually allow in your facility. So there are lots of guidelines, and I was actually talking to our environmental health director this morning, and she said, I started reading through it last night, and it's very specific. And so definitely if you're unsure, you can call the health department, but you can also go online to the governor's website and get those guidelines as well.
So will the health department actually be enforcing this?
We're still kind of learning how the enforcement's going to happen. Of course, with restaurants, since we inspect restaurants, that would fall into kind of our domain as to how a lot of this is laid out. Mm-hmm. We also inspect pools, so that will fall in, under us as well. And so one thing that we noted in the guidelines is that public pools will not be allowed to open in this phase one kind of re-entry process. And so there are lots of little nuggets of information we're kind of sorting through at this time. But if you are in question, they can always reach out to us, and we will kind of help navigate that for them. Right, as we navigate it ourselves.
Yeah. So we're here with Melissa Brantley. We're getting an update on what's actually going on as the first phase of our state starts to open up is right here in Lawrence and surrounding counties. We're all affected by it. We'll take a short break and be back. Stay with us.
Hello, I'm Darren King with Cleanliness and King Insurance. And many of us do not like to talk about it, but no family needs to go without a life insurance program. Show your family how much you love them by preparing in advance with a life insurance program. Cleanliness and King Insurance can help you with term insurance or permanent insurance. Regardless of your need, your age, or where you may be in life, life insurance is a critical part of financial planning for you and your family. Please give us a call at Cleanliness and King Insurance, 272-8019.
First Lawrence Bank invites you to experience banking at its best. Whether you have personal or business needs, we're a full-service bank big enough to handle all of your banking needs and small enough to provide you with that personal touch you've grown to expect from a community bank like First Lawrence Bank. Looking forward to your future. That's First Lawrence Bank in Dublin and Dexter, member FDIC.
Hi, I'm Pam Tillery.
And I'm Jody Tanner, and we are downtown at the Fred Roberts Hotel at Emily Kite's office.
And we're on the balcony overlooking historic downtown Dublin, where we have local boutiques, great restaurants, and gorgeous architecture.
And we would love to share this view with you at your next closing.
So give us a call. I'm Pam Tillery.
And I'm Jody Tanner.
And we are the T&T Group.
Okay, we're back with you. We talk about the services usually just for cleanliness of inspection that the health department does each and every, I guess, quarter it's been done. But a lot of that effort's going to be stepped up. You guys are going to be real busy, aren't you, Melissa?
Yes, we've been busy, very busy. There have been a lot of 7-day work weeks for us actually every day since this began, 6 or 7 weeks ago. Yeah. But definitely as we kind of start to reopen, we'll step it up a little bit and really support those in our community who have questions and concerns. And as they reopen, we'll be there to help them.
So
through
truly,
that process.
Melissa, if everyone will follow the guidelines, we could be an example for the rest of the United States.
Absolutely. And if you look at Lawrence County, really, our numbers, as we look at it, we're close to 50, but that's over an extended period of time. And so I really applaud the people of this area who have done what they could to kind of keep those numbers down. I think it shows that we can follow rules. We're rule followers here. Yeah. But we encourage people to continue to be vigilant for the foreseeable future until we kind of see how this all plays out. One thing that we had said is that we weren't sure if we were at our peak. We still think that that's probably going to be end of April into May. And so as we kind of hit that peak and then we start to kind of see those numbers decline, very, very important to kind of continue to stay home when you can. And to practice the hand washing and to protect yourself when you do go out. And we will continue that message for the foreseeable future.
Yeah, so we talked last time, you were here about symptomatic individuals and testing. Has the testing increased?
The testing has increased. We have had a testing facility in Lawrence County for weeks now. But actually on Monday we expanded that to Telfair County, and so Telfair County also has a drive-through testing facility. We were trying to really support those communities in our southern counties, and so that's why we opened the one in Telfair County to kind of help alleviate that travel burden for some of those that live in our southern areas, and that's been very successful. So the majority of our staff right now are supporting testing, but we're also beginning a phase where, as we start to see that kind of downward decline, at least that's what we anticipate, that we'll go back to more stringent contact tracing. So if we do have positive cases, contacting those contacts and really urging them to stay home. When our cases kind of got, as they were growing, it's harder to do strict contact tracing, but we'll see ourselves kind of start to go back to that so that we don't see another explosion of cases. We can kind of keep them at the minimum. And so our focus will start to go back on supporting those who are beginning to reopen, but also to really ramp up contact tracing within our community.
Okay, so we have healthcare providers, we have people who have been first line people who were applicable for the test if needed. So now that we look at barbershops, beauty shops, restaurants, will they be frontline workers as well?
Actually, we'll still continue healthcare providers as far as testing goes. Asymptomatic individuals who can be tested will primarily be healthcare providers. And police, fire, first responder type individuals. And then anyone who is symptomatic can be tested, even a child. For so long, in the beginning, we were not testing anyone under a certain age, but now we can test anyone of any age if they're symptomatic.
Okay, all right. That's good information to know now. And as we look at all the individuals that will be going to work, will be out there, it's still a personal choice, right?
Yeah, absolutely. It's still a personal choice. And just because the nail salon opens or the hair salon opens or the barbershop opens, it doesn't mean we're saying you have to go get your hair cut or your nails done, but they'll be there if you want that. And if you do, and of course we want to support our small businesses, and we understand how hard hit they've been through all of this. I mean, I think back to December, how could we have ever imagined that we would be where we are right now? But we still urge people to be smart when they do go out. And the guidelines for going into these kind of the first phase of reopening is that they wear face protection, and that you do as well. And that those who go into the salons, it's not a requirement that they wear them, but of course we encourage people to wear them when they're out in public. So we would encourage you to do that.
Yeah, just good advice. I mean, I guess people in our community are still making those masks, a lot of them out there. If you'll get on social media, get in touch with the health department, get in touch with Here's at TV 35, we'll be glad to help you with anything like that you'll need to start to venture out. Safety obviously is first. The largest hospital in our area obviously is Fairview Park Hospital. Let's talk about what they've done, what procedures and how safe they are as far as treating patients of any type. So what do you think about them? You work hand in hand with them, Melissa, so speak to us about Fairview Park.
Well, Fairview Park has been a great partner with us, and we are in touch with them almost daily, or really daily. And so a lot of the tracking we do may have to be with their patients. So of course our epidemiologist is in touch daily with their staff for contact tracing purposes, for follow-up and things of that nature. And of course if they have symptomatic patients who are hospitalized and they're tested and confirmed, and those are reported back to the health department. So we have a great relationship with our hospitals, not only Fairview Park, but the other hospitals in our health district, and we're thankful for those relationships that have really been strengthened through all of this. And if you look at the downside of COVID-19, there's been lots of downsides, but I think the positive is that relationships have been strengthened in our community, and certainly the public health hospital relationship has been strengthened through all of this. So.
Yeah, talk about a team coming together, a portion of our community that's really come along and become a solid team and good and all on the same page, working hard. So, hats off. We continue to see the frontline workers saluted by so many people, but you can't say thank you enough, can you?
No, and we certainly appreciate the work that they're doing. I was on a phone call yesterday, and I was talking to someone at the hospital, and I could hear something in the background, and it was the Rocky theme song playing, which is apparently something new that they're doing when a COVID patient is released or taken off a vent.
Yeah.
They play that for them. And it was so special to be part of that. It was the first time it had happened. And she was crying and I had chills. And I said, this is why we do what we're doing, is to see those patients who have come through this, come off a vent or gone home. It makes it all worthwhile. The long hours that you work to kind of see those patients recover. It's amazing.
Yeah. We'll talk about a few more services offered by South Central Health District. We'll take a short break and be right back. Stay with us.
Hi, I'm Helen Powell. Been serving the Middle Georgia area since 1985. If you would love an exciting career, please call me. Careers in Cosmetology, 129 North Franklin Street, 272-1967.
Hi, I'm Ashley. I'm an upcoming graduate from Careers in Cosmetology. It's been a wonderful experience, and I encourage you to contact Ms. Helen Powell for more opportunities.
Hello, I'm Christy at Careers of Cosmetology. I've recently enrolled here and I'm excited about the opportunities that lie ahead.
Hey, my name is Daphne Jackson. I'm excited to be enrolled in Careers in Cosmetology. If you would like this opportunity, contact Careers in Cosmetology.
Hi, my name is Caitlin. I've been enrolled in Careers in Cosmetology for about 4 months now. I'm really enjoying it, and I think if this is the career for you, you should definitely come see Miss Helen Powell.
Careers in Cosmetology, 129 North Franklin Street. Our number is 272-1967. Give me a call.
Hi, I'm Jeff Cannon, President of Citizens Bank of Lawrence County. When we began looking for a location for our second Dublin banking office, the historic Henry Building looked like the perfect spot because Dublin and Lawrence County is our focus, and making banking easier and more convenient for our customers is our goal. Citizens Bank of Lawrence County, member FDIC, and an equal housing lender.
A local full-service community bank offering quality banking services. Citizens Bank of Lawrence County, now open in downtown Dublin.
The City of Dublin's Natural Gas Department is offering a $1,000 rebate on the purchase of a natural gas, stove, furnace and tank or tankless water heater for new construction homes or if you're remodeling your home. Individual rebates include natural gas tankless, up to $400 rebate and free gas service installation. Natural gas tank, free 40-gallon or $200 rebate on other sizes, free gas service installation. Natural gas furnace, $200 rebate. Natural gas stove, $100 rebate. Natural gas dryer, $100 rebate. Natural gas grill, $100 rebate. Natural gas logs, $100 rebate. Maximum yearly rebate? No maximum. Save now. Save later. Call the City of Dublin Natural Gas at 277-5048.
All right, we welcome you back. Melissa, we'd like to really talk about the other services offered by South Central Health District and whether or not they're still in progress. You know, some people have adjusted their hours, some health districts have adjusted it, especially for anyone to come in, but you have a specialty clinic, you have a Healthy Start, Babies Can't Wait, the dental office. You have several offices that are are they still operating, and can people still take advantage of the service?
All of our health departments are open. They're not open every day, but if you go to our website, and it's www.southcentralhealth.info, you can find what days they're open. And part of that is due to the fact that a lot of their nurses, on the days they're not working, are kind of supporting the testing facilities, and actually coming to the district office and supporting us there. So that's why we've kind of staggered some of the openings of those health departments. Our offices that were doing home visits, we have stopped the home visits for now, and certainly you can understand why that is, to protect our staff, but also to protect the populations that they serve that may be in that kind of vulnerable population category. On an emergency basis with our dental clinic, they will see patients. It really just depends on the scenario that they're dealing with.
Yeah.
But all of our offices are taking calls and are working whenever we can to support the patients in our facilities. We do encourage people who are going to the health departments for a service to call ahead before they go. It just kind of helps us to anticipate what we have coming in. And of course, if you are being tested for COVID-19 or you feel like you have COVID-19, don't go to the health department. Call the district office, that number, hotline number that we've set up, please call that. And that's 478-275-6570. So don't show up at a health department with symptoms, call that number before.
Yeah, it's just good advice. Take care of yourself, take care of others that are going to be there. And then when we look at Healthy Start and Babies Can't Wait, you know, that's a service that must be provided. This is very important. So they can also call the number and get the help they need,
Absolutely.
Right?
And if you don't know those numbers, again, go to our website and you can get them. But they are still there. We may have staggered shifts because of the number of people that were in a building at a certain time. We wanted to follow the guidelines as well, so we've tried to cut back on the number of people who are in a building at a certain time. So a lot of those people are working from home, but they can still reach out to us, and we will support them however we can.
Yeah, so don't put off the services that are desperately needed, especially for those young children.
Right.
Or for yourself included. And make that phone call first if you have someone who's symptomatic.
Right. Please call ahead so that we can get you into a testing site.
All right. Melissa Brantley been here with us to give you an update on what's going on in the state as we begin to reopen. If we're smart again, we can be an example to the rest of the nation in following the guidelines, making the most important decisions. If you have questions or comments, feel free to call the health department, get in touch with your local officials, look on that website, and you'll find what you need. Thanks for joining us right here on TV 35. We'll see you next time. Melissa, thank you.
Thank you, Ron. I appreciate it.